Hi, welcome to the Fundamentals of EHR Usability tutorial. I'm Amy Franklin, and I'm presenting these tutorials on behalf of myself, Dr. Mohammed Waji, and Dr. Jiajie Zhang. We're all faculty members at the University of Texas Health Science Center at Houston, and this is part of an initiative funded by the Office of the National Coordinator for the SHARP-C project. We're out of the School of Biomedical Informatics, and we'll be telling you a little bit about EHR usability today. The learning objectives of these tutorials are to help you understand the principles of usability, understand the significance of usability in human-centered design, as well as the consequences of technology-driven development. As part of these tutorials, we're going to walk you through several different usability methodologies, specifically heuristic evaluation and user testing. And through these techniques, we're going to help you understand ways to evaluate health information systems. By the end of this, you'll have done some hands-on activities about expert review and user testing, and we'll provide the materials to get you started in detecting usability problems in your own products. So what is usability? There are a number of different definitions of usability, from ISO standards to the things you'll find on usability.gov. Here at the SHARP-C, we use the TURF definition of usability, which is specific to EHR systems. It can be used for any kind of usability, but it is defined as how useful, usable, and satisfying a system is for the intended users to accomplish specific goals in a given work domain by performing a certain sequence of tasks. And I'll walk you through these ideas step by step, but the idea is that a system has to be useful, usable, and satisfying in the accomplishment of work. There's been a lot of interest in usability in the recent years, and we're going to talk about how safety-enhanced design has really pushed this initiative forward. But the HIMSS group has been thinking about usability for a while now, and these are some of the slides that they have presented talking about the value of usability. They split it off into two different kinds of value. The things that impact the individual, increasing individual effectiveness and efficiencies, as well as things that affect an organization as a whole. All of usability is supposed to come together to help improve patient, provider, and organizational outcomes. We're going to talk about the ways in which some of instances of poor usability have decreased support for clinicians as well as decreases to the patient experience. And then we'll talk about the flip side and the ways in which usability can actually improve these experiences. Where should you do usability? Well, our answer is that usability can be done in any part of a company. It can be done with the developers and the designers when they're actually building the product. It can be done with the marketing agents. It can be done with the engineering group. Lots and lots of people have the ability to contribute to usability in every phase of a product's development. That's from the beginning to the end, when you're building up the system, as well as when the system's ready to roll out and you're trying to get feedback on its performance by actual users. That's all usability, and it needs to be done at multiple stages by multiple groups. And it does require a strong commitment from an organization to be dedicated to actually allocating that kind of resources to the development of a single product. So when it comes to EHR systems, there are a number of examples where people have published in the literature and the popular media ways in which poor usability has affected the interaction that doctors and patients have with each other, as well as doctors' interactions with the systems. We'll talk a little bit more about how the American Medical Association has come out with some stances on what they need in terms of usability. But here are some examples of things that we've seen at SHARP-C in the wild in actual clinical environments. This is an example of an EHR system that was implemented in a hospital system, and the EHR system had a number of icons built into the system. So the intent of the icons was to, at a glance, tell people what the status of patients were, where their labs were, where all kinds of information might be. The problem was there were dozens and dozens of these icons, and at least when you're looking at the screen, you couldn't see what the icons all meant. So what happened is the clinicians had to print out what I refer to as these wings on the screen, where they are showing what those icons mean by putting the text here below them. Only when you did a tooltip or hovered over it on the screen could you actually find out what those icons meant. And icons aren't immediate and transparent and obvious as you might expect. The example I like to give is the fact that the average high school student has no idea what the floppy disk means in a software product when you use it to hit save. They don't recognize what floppy disks are. For them, that's just the icon that means save. To people who developed that software and at the time that that was developed, the idea that floppy disk as save was very clear and transparent, but over time it doesn't really mean the same thing. Now it just means save. It doesn't mean a floppy disk, which was a format for saving information. Similarly, these icons that have been developed that are supposed to be fast and easy, like a yellow beaker to indicate a urine sample, may not be as clear and obvious as people might expect. So excessive icons really put demand on clinicians to remember what it's for. Things like this pop-up window are another example of instances where the system was trying to support clinicians by giving them the right information, just putting it in their face. But the problem is that it obscures what's behind it, it interrupts the workflow, and it may not have all the information you need. So pop-ups, as we've all experienced when you're trying to move through websites or move through anything, disrupt what your intended work was. And that's one way that might cause problems. There's a lot of publications out there about repetitive, inconsequential alerts, with the high override rate for alerts being anywhere from 60 to 90%. And what we mean by inconsequential are alerts about alerts, alerts that say we don't have any information for that alert, those kinds of things. And it's very wearing on providers to constantly be triggered with these alerts, particularly when they're not very meaningful. The more often you receive those alerts, the less likely you're able to respond to them when you should. Sort of like the boy who cried wolf. Recently, there was a publication out in JAMA where they actually looked at how much time was spent using EHR systems before and after implementation. In this study, they found that across all types of respondents, because they looked at different levels of providers, they looked at doctors and residents, they looked at mid-level providers, those kinds of things. And they said across all respondents, they lost 78 minutes per clinic day just entering stuff into the EHR system. And so this has had a huge effect on the way physicians practice. So much so that recently the American Medical Association has actually published the 8 EHR usability priorities that they feel are really going to impact the quality of care provided by physicians. And one of the things here that I've highlighted is to reduce cognitive workload. And that's what we're going to be talking about in terms of the kinds of testing that we're looking at for design principles that stress memory, as well as user testing where people get lost in the system or it takes a long time to complete the work. There are a number of other usability issues here, and we can talk about those in later tutorials. In terms of usability techniques, there are a wide range of techniques, and we're going to focus on one technique that is completed by the experts that doesn't require end users, as well as user testing, which does require representative individuals who would be users of the system once it's gone live and is out there in the wild. There are a number of techniques that split by this division of being used by human-computer user experience HCI experts, as well as those that involve representative users where you can use focus groups to get people's concerns, interviews to find out about their experience, surveys to get broad responses to questions, ethnography to take a deep dive into how systems are used, as well as user testing to find out how systems function and how you would like to benchmark them against other types of performance.